Hi, this is Dr. Marty Klein. This week's quickie is about popular sex tools you probably don't need. The world is overflowing with sex advice. A small part of that advice is actually useful. It focuses primarily on helping people relax and accept themselves and communicate. The rest of the sex advice out there frequently addresses the wrong problems. Typically, attempting to reduce people's sexual symptoms without addressing their actual problems is foolish. It's lucrative, but it's foolish. In many cases, today's sex advice takes distressing experiences like lack of erection when you're drinking or lack of orgasm when you're angry, and agrees that these are problems to be solved rather than reasonable functioning under anti-sexual conditions. Most people seem to prefer sex advice that doesn't challenge their worldview, the view that, say, male and female sexuality are dramatically different, that everyone should feel desire for someone they love, that desire should feel the same whether you're 25, 50, or 75, and that if you don't like how your body behaves during sex, there must be some intervention to tame your body. Well, in over 30 years as a sex therapist, I've learned that most sexually dissatisfied people would rather focus on almost any solution rather than an approach involving relaxing, accepting themselves, and communicating. It's like I've told my own physician, Doc, I will do anything to lose weight except change the way that I eat and the amount that I exercise. A lot of my clinical work involves helping people discover which problems they really have and how they're expressing themselves in sexual symptoms. Then we fix those actual problems. But if we don't agree on what the real problems are, we can't agree on how to fix them. So here are some solutions to sex problems that you probably don't have. Viagra. Erection drugs like Viagra can be helpful for people with medical problems like diabetes. And a small daily dose of Cialis is now often prescribed after prostate surgery to help support the reintegration of nerves. But Viagra is not an aphrodisiac, and it won't help you get or stay hard if you're drunk or if you're with someone you don't desire. Your body isn't designed to get an erection under those conditions. I especially discourage young adults from using the drug unless they have a real medical issue, because understandably, once guys start using Viagra, it's hard to get them to stop if they don't have a history of natural erections. Instead, most young men would benefit from figuring out how to create the circumstances under which they get erect easily. Now then there's Tantra. Now Tantra is a centuries-old tradition that purports to harness sexual energy rather than allowing the spontaneous expression so common among the undisciplined masses. Tantra's program has rules for exactly how to manage various sexual interactions. This is exactly the worst thing for most people, because most people struggle with their anxiety about whether they're doing sex right, and that leads to sexual misery. Tantra can be a nice addition to a sexual repertoire that's already based on a relaxed celebration of bodies and eroticism. But people like that are not looking to fix sexual problems. Tantra is something that people can enjoy, but it isn't a solution for people who are struggling. Then there's vaginal squirting. As a desired recreational experience, this was unheard of just 10 years ago. Women who wet the bed during sex were ashamed and even tried to prevent the orgasms that were so messy. Unfortunately, most women still feel that way. A small number of women have now proclaimed that squirting, propelling fluid out of the vagina during orgasm, is one of life's great pleasures. And indeed, some women who learn how to relax deeply while getting sexually excited and who can explore and enjoy stimulation in various places deep in their vagina, usually by a finger or a toy, do report entirely different orgasmic sensations, often accompanied by some literal flooding. Do you and your partner need to do this? No. If you have trouble climaxing, or if sex is painful, or if lovemaking is boring, should you do this? No. There are much easier aspects of orgasm that women can learn. More importantly, difficulties around orgasm often involve self-consciousness, criticism, unrealistic expectations, and having sex in ways that somebody doesn't really like. So consciously trying to squirt won't solve any of those. Then there's shaving or waxing pubic hair. If you want to go ahead and do this, go ahead and do this. If you think you should do this, don't do this. If you think you should do this because your partner thinks you should do this, maybe you should think about whether or not you're in a healthy relationship. If both partners think that a shaved or waxed pubic area is sexy or more convenient and it's worth the hassle, sure, go ahead. But if your partner is unenthusiastic about going down on you and blames the hair, you better talk that over. For more access to your genitalia during oral sex, either of you can easily use your fingers to move the hair aside. And if your partner tells you that you're ugly down there, consider getting a new partner. Testosterone. Testosterone treatment does not improve erections or much else in men with normal testosterone levels. In fact, it typically doesn't help men with low testosterone to have better erections or more desire either. A lot of men and their physicians tend to like testosterone as an intervention because it's tangible and it doesn't require any changes in lifestyle, such as increasing non-sexual intimacy. But extra testosterone doesn't cure anything. It doesn't boost the body's organic manufacture of it, and withdrawing from testosterone can be quite unpleasant. The pseudo-testosterone boosters advertised on late-night TV are pretty worthless. You're better off buying the new steak knives or trillion-watt flashlights they advertise every night. So, if these common interventions mostly aren't helpful for sexual problems, what is? Relaxation, self-acceptance, communication, and no purchase necessary. I'm Dr. Marty Klein. Thanks for joining me.